The impact of COVID-19 on research, innovations, new concepts, and development in the modern era. There are some positive impacts, such as new method of teaching, new method of doing research, new digitalized system, new condition of work, new facilities on the workplace. The recent experience with the spread of infectious diseases around the globe suggests that no part of the world is any more secure than any other one. While the world has known about pandemics for centuries, never has the speed with which infections are carried around different parts of the world been as pronounced as the latest pandemic, COVID-19. Therefore, nobody is safe unless everybody is safe. There are negative impacts. The pandemic disease coronavirus had very serious impact on our daily life, especially during the lockdown in 2020 and 2021 with new conditions of work. Some colleagues, academic students are placed in quarantine, and of course we don't enjoy our freedom of movement and speech as usual. Now academics were not prepared to perform online classes, examination online, and all related issues to research and teaching. Therefore, it is crucial to know what we can implement to face that pandemic. So we need innovations. Consequently, academics over the world has to adapt and to adapt to new innovation to tally with the demand in tertiary education. We need a digital spectrum. Everything must be digitalized. In case there is a new lockdown, we are prepared as explained. The implementation of the lockdown in most regions of the world has inevitably forced researchers to bend down towards the digital spectrum and with the digitalization of our economy in order to cope with the digital sphere, which is inevitable. It is a case of force majeure, that is, we were not prepared for the pandemic disease, but now it's not a force majeure, we must be ready. Everybody of us, academics in the tertiary education, were not prepared to face this new and expected environment. As explained now, it is no more a force majeure. We must be ready to face the disease once more. Digitalization, a new concept, the implementation of concept of digitalization at the University of Mauritius, for example, will be a very good initiative for all stakeholders, including students, lecturers, researchers, and administrative staff. Momentum, the new possibilities have led to growing data volumes and higher speeds at which database insights are processed and disseminated. Call for the adaptation of digitalization or gain momentum, and this also concerns most universities in the world. And online platforms, during the national lockdown due to COVID-19 pandemic, lecturers were held for the department through online platforms such as Zoom, Google Meet, Google Classroom, and Google Drive. Indeed, the use of online platforms have proven to be very effective in the context of the COVID-19 as it allowed academics to complete the syllabus for the academic year 2019, 2020, and 2021. There are obstacles, however. There are improvements, but there are also obstacles. Many students especially voice out their concerns that they do not have access to proper internet connectivity, nor they do have a laptop computer at home to undertake works assigned to them. A solution therefore has to be found to assist students who face those constraints. Because of their practical nature, not all modules can fully go online or blended mode. Face-to-face sessions ought to be conducted to deliver the lectures and enhance the learning experience of the student. It will be more important also that the University of Mauritius, for example, come forward with a uniform platform that considers all the specificities of teaching and learning processes to ensure consistency, efficiency, and effectiveness in all our research and lecture. Training, for example, Mentimeter, we have new technologies, we don't know how to use them. Therefore, it is important to have the training of academics. Is important when considering the use of e-learning methods to deliver lectures. Training of academic staff should be done in order to make the use of the various e-learning methods so as to enhance student learning experience. Students also must be trained as well as non-academic. Lectures are delivered online as part as staff engagement, moving from face-to-face suddenly to a mode of delivering lecture to online blended mode should not negatively impact on the teaching, research, financial, and administrative benefits of. We have to enhance also our pedagogical experience. Digitalization of universities will surely bring many innovation forms of learning, teaching, and pedagogical experience to both academics and students. Some recommendations, of course, training need to be provided on technical troubleshooting, as working from home and interaction with students at different time slots will mean CITS support not available at all time, and academics should be equipped with the basics of troubleshooting independently. Some recommendations: second, increase the internet allowance for us to access the highest bandwidth broadband to allow for meetings, lectures, and interaction to happen smoothly from home. Electricity and phone allowances to share the cost of same for academics delivering lectures from home. Fourth, for adoption of online virtual learning to count for some aspect in promotion from lecturer to senior lecturer to associate professor, for example. Therefore, as academic, we would suggest that the word some be replaced by substantial and significant. For example, around the world now, most academics are going online during the pandemic period. It's high time that the technical and learning dimension of our work get the recognition it deserves compared to the criteria for promotion. For example, artificial intelligence is increasingly proliferating the healthcare landscape, and we must make use of it with immense promise for improving health outcomes in research-constrained settings. Artificial intelligence-powered health data analytics can enhance medical diagnostics and improve decision-making when it comes to training options and health. With over 1.3 billion of people owning a smartphone today, artificial intelligence AI-based solution can bring diagnostics to people with limited or no access to medical care, free up capacities of health professionals to focus on critical cases, or help save lives in emergencies by allowing patients to be diagnosed even before they arrive in hospital for. The COVID-19 pandemic has exacerbated the deployment of artificial intelligence in healthcare. For example, making artificial intelligence tools available to effectively overcome a fast-moving pandemic requires government officials, developers, and health organizations to observe the fundamentals of regulation and focus on use cases and models with reliable and validated data sets. This poses several challenges such as access to good quality and accurate data, data protection, sharing and privacy, identity and gender, racial and poverty-based bias. When it comes to employers to provide a working environment that prevents burnout as much as possible, new research suggests that addressing burnout once you're suffering from it is a little more complicated. There are steps that organizations can and should take to support their employees, but the most effective measures to counteract burnout are generally driven by the individual. Specifically, employees should start by identifying the sources of their burnout and should then take action by focusing on self-care, acts of kindness towards others, or some combination of the two. Most importantly, the authors stress that compassion, whether towards ourselves or our colleagues, is a muscle that can be trained, and that developing and practicing compassion is a key to combating burnout. It is a universal concern in socio-economic development. What role can national research universities play in supporting national efforts in the development of containment and treatment protocols, medication, as well as vaccine? What new sustainable strategies can be adopted to deal with poverty, inequality, and employment in the mitigating the impact of the disease pandemic? There are some serious cost concerns on research, for example, what institutional vulnerabilities were exposed by recent pandemics, and what new steps can be taken to strengthen the institution. To what extent our country public health situation a concern of inequality, food insecurity, or governance? What has been the cost of the pandemic to economies, including the economic, social, human, and institutional costs? Thank you.